plantar fasciitis as well. Remember, if with plantar fasciitis, it's the origin of that plantar fascia on the calcaneus that hurts. So every time you step down, that plantar fascia pulls at its attachment. Well, if I support that arch and it doesn't flatten as much, you don't get as much tension, you get less pain. And I don't know if everybody remembers, we talked about plantar fasciitis. The other thing that can happen with plantar fasciitis is this calcaneal fat pad thins in older people. As we get older, it gets kind of squished out and we just have less tissue there. The other thing that those teardrops do as they come around is they do this, is they squish the calcaneal fat pad and they keep more material down here. So you actually increase the padding that they're standing on and it feels better. Okay? So many times they get immediate pain relief or they feel better over the course of the day. This next one I'm going to do is another one to affect the level of pronation. So if I have someone that's pronating excessively, this is called a navicular sling. What I'm going to do here, I'm going to start down low. I'm going to come across the medial part of that foot and finish somewhere up there. So just like with the patellofemoral taping, I'm starting with a white base. I'm not doing any tension. It's just there. It's flat on the skin. I'm not using that to move anything. Now, when she stands up and she pronates, we collapse in here, right? That's an excessive pronation. So what I want to do with this brown tape is come across here and grab about where that navicular is, and I want to lift that navicular. So what I'm going to do is tear my piece of brown tape about a little bit shorter than where that white is. And just like we did with the patellofemoral taping, where we put the tape there and then we use the tape to sort of move or improve the position of the patella, I'm going to grab this, I'm going to hold the tape in place, I'm going to lift her navicular. I'm going to almost supinate her a little bit, drive that navicular up, and now I'm going to pull this tape and lock it down here. So now, when she goes to stand up, this navicular is being lifted up that way, sort of, you got your posterior tib down here, which controls the rate at which we fall into pronation, right? Remember that from our test? Well, you can see the trajectory of this is sort of similar to where that posterior tib is. So go ahead and stand up. So now, if this tape stays on and is effective, if it's providing a bit of a lifting mechanism, it's going to minimize the amount of pronation that can occur through there. That make sense?